Welcome to the deep dive. Today, we're going to be exploring these drugs. They're called cholinergic agonists. You might also hear them called parasympathomimetics.
Hmm.
And, these medications, they stimulate the parasympathetic nervous system, which, as you know, is such a key player in how our body rests and digests. So as a nurse and a student, you're really going to find this deep dive relevant because we're going to unpack all the actions and uses and considerations for these drugs.
Yeah, that's right. And cholinergic agonists, they have so many uses and applications. They're really essential for nurses in so many settings. So today we're going to really try and dig deep into the complexities of them. We'll pull insights from the text you provided, the chapter, objectives, key points, even key terms, and we'll even go through some of those review questions just to really make sure we have a good understanding of these fascinating drugs.
Before we get into the specifics of these agonists, let's take a step back and revisit the autonomic nervous system. Now, you're probably already familiar with this as a seasoned nurse, but it never hurts to have a little refresher, right?
Never hurts. And the autonomic nervous system, it's like the autopilot of our body. It regulates all those essential functions like heart rate, digestion, breathing. We do it without even thinking about it. And it's actually divided into two main branches: the sympathetic and parasympathetic nervous systems.
Okay.
And so the sympathetic nervous system, it's that fight or flight system that gets us ready for, stressful or dangerous situations.
Right.
And then you have the parasympathetic nervous system, which is what we're going to focus on today. And that kind of governs all the rest and digest activities that, help us relax and conserve energy.
So to use a familiar analogy, if the sympathetic nervous system is like hitting the gas pedal and the parasympathetic nervous system is like hitting the brakes,
Yeah, exactly.
slowing things down, helping us recover.
Exactly.
And that brings us to acetylcholine, right? It's that primary neurotransmitter in the parasympathetic nervous system, basically. It's that chemical messenger that carries signals between nerve cells.
Exactly. And, acetylcholine, it works by binding to these specific receptors, kind of like how a key fits into a lock.
Mm-hmm.
And there are two main types. You have your nicotinic and your muscarinic receptors. And these receptors are all throughout the body, and they're responsible for all sorts of those parasympathetic responses.
The chapter text mentions that nicotinic receptors are found in ganglia, which act as relay stations for these nerve signals. Muscarinic receptors are located in the effector organs, so that's the muscles and glands that actually carry out the commands from the parasympathetic nervous system.
Exactly, yeah.
So now let's actually talk about these cholinergic agonists.
Yeah.
Sometimes called parasympathomimetics, like we talked about. They mimic what acetylcholine does. They amplify the signals of the parasympathetic nervous system.
Right.
And their effects can be pretty wide-ranging, anything from influencing digestion to controlling the size of our pupils.
Exactly. And they can do this in a couple of ways. They can directly stimulate those cholinergic receptors, or they can do it indirectly by increasing the levels of acetylcholine, kind of by stopping it from breaking down so quickly.
And the objectives really point out how important it is to understand the difference between these two mechanisms, direct acting and indirect acting. So direct acting agonists, they go straight to those receptors and they just trigger a response. But indirect acting agonists, they take a bit more of a roundabout way. They're like, okay, we're going to boost the amount of acetylcholine by blocking that enzyme that's responsible for breaking it down. What was it again?
Acetylcholinesterase.
Acetylcholinesterase. There we go. So do you want to give us some examples of these agonists in action?
Sure. So let's start with bothanicol. It's a direct-acting muscarinic agonist, so it goes right to those receptors. And it's often used for something like urinary retention. So by increasing the bladder tone, it helps people urinate more easily. And then you have something like pilocarpine, which is another direct-acting agonist. It's actually used in eye drops to constrict the pupils. It can be helpful in treating glaucoma.
And then the text also mentions some indirect acting agonists, like donepezil, which is commonly prescribed for Alzheimer's to try and improve memory and cognitive function.
Yeah.
And it does this by boosting those acetylcholine levels in the brain. And there's also pyridostigmine, which is used to manage the symptoms of myasthenia gravis, which is that condition that causes muscle weakness.
Right.
And that works by increasing the amount of acetylcholine at the neuromuscular junction.
Yeah, exactly. And the key points here really emphasize that cholinergic agonists are used for such a wide variety of things. I mean, we're talking about treating gastrointestinal and urinary issues, eye conditions, and even neurological disorders. It's really remarkable how versatile these medications are. But of course, like with any medication, we have to be mindful of the potential side effects.
For sure. Okay, so Before we move on to the effects and how they are actually used clinically, I think it would be helpful to go over some of the key terms.
Yeah, absolutely.
These terms are super important for understanding what we're talking about, especially as you continue your nursing studies.
Definitely. So let's start with, the most important one, acetylcholine, right? It's the neurotransmitter that really drives the function of the parasympathetic nervous system. This chemical messenger, it helps the nerve cells talk to each other and triggers all kinds of responses in our organs. And then we have acetylcholinesterase, which is that enzyme that breaks down acetylcholine. So it makes sure those signals don't linger for too long.
Okay. And then we have Alzheimer's disease, which is that neurodegenerative condition where we see progressive memory loss and cognitive decline. And like we mentioned before, some of these cholinergic drugs actually play a role in managing those symptoms.
Right.
Another important term is atony, which refers to a lack of normal muscle tone. And that's relevant here because these agonists can help increase muscle tone in certain organs, like the bladder. So it helps with things like urinary retention.
Exactly, yeah. And then we have to remember cholinergic crisis, which is basically a really serious consequence that can happen if someone overdoses on a cholinergic drug.
Right.
It happens because there's way too much stimulation of the parasympathetic nervous system and can lead to some really serious symptoms like even circulatory collapse or respiratory paralysis.
Okay. So then cholinergic receptors, which are those binding sites for acetylcholine, they're basically divided into two main types. Muscarinic receptors, which are found in those effector organs, and then nicotinic receptors, which are located in the ganglia, those relay stations for the nerve signals. And these receptors, they're all over the body, helping with all those different parasympathetic responses.
Exactly. And lastly, we have meiosis, which just means the constriction of the pupil. And that's one of those really important effects of these agonists. It's especially important when we're talking about treating glaucoma.
Right.
Because that's when reducing that intraocular pressure is so crucial to protect the optic nerve.
Okay, great. Now that we've covered the basics and gone over some of the key terms, let's move on and talk about the specifics.
Yeah, let's do it.
What exactly do cholinergic agonists do in the body? Knowing this is going to help us really understand how they're used in clinical practice.
Okay, so think about it this way. Cholinergic agonists, they kind of mirror what the parasympathetic nervous system already does. They stimulate digestion, they help with bladder and bowel activity, they slow down the heart rate and constrict the pupils. And all of this happens because they stimulate those muscarinic and nicotinic receptors all throughout the body.
The chapter text really breaks down those effects by each body system, which I think is helpful.
Yeah.
We're going to talk about those in a lot more detail when we get to the clinical uses. But before we do that, why don't we take a look at those review questions you gave us? I think they'll really help us see if we're understanding everything so far.
Okay, sounds good.
So the first one says, a patient is prescribed bethanical for postoperative urinary retention. Which statement by the patient indicates that the teaching has been effective?
Okay, so this question is getting at, does the patient really understand what bethanical is supposed to do and what potential side effects they need to be aware of?
Right. And the answer, Key says the correct answer is, the medication will help increase my bladder tone so I can urinate. So it looks like this response really shows that the patient understands how the medication is supposed to help them empty their bladder.
Yeah, and those other options, either they're not quite right about how the drug works, or they focus on side effects that are possible but not the main goal of the treatment.
Okay, so next question. The nurse knows that the therapeutic effects of indirect-acting cholinergic agonists are due to which action? Now, this question really focuses on how those indirect-acting agonists work. Remember, we talked about how they're different from the direct-acting ones.
Exactly.
And the answer key tells us that the correct answer is they allow acetylcholine to accumulate at receptor sites.
Right.
Which is exactly what we talked about before. They work by blocking that enzyme that breaks down acetylcholine so more of it can build up at those receptor sites. So the effects of acetylcholine are stronger and the parasympathetic activity is ramped up.
Exactly. And this difference between how the direct and indirect agonists work is really important to remember when we're thinking about how they're used and what side effects we need to look out for. We'll definitely get into more of those specifics as we talk about the clinical applications. So now that we have a good foundation, I think, let's dive into the real world stuff. How are these cholinergic agonists actually used? As a nurse and a student, this is going to be really interesting, I think.
Yeah, definitely. I'm excited to see how it all comes together in patient care. And the chapter text really lays it out, all these different uses for these agonists, everything from managing like GI issues to urinary problems, eye conditions,
Mhm.
even stuff with the brain, like neurological disorders. It's a lot.
Yeah, it is. It is. So let's start with something I'm sure you've seen a lot as a nurse: urinary retention after surgery.
Right, right.
Imagine you've got a patient who's just had abdominal surgery, recovering well, but they're having a hard time peeing. That's where a drug like bethanechol can really come in handy.
So bethanechol being a direct-acting muscarinic agonist, it's going right to those receptors and making that bladder muscle contract. So more bladder tone, easier to urinate. It's basically doing what the parasympathetic nervous system would normally do to help empty the bladder.
Exactly. And it's not just for after surgery. Bethanol can also be used for neurogenic bladder, where there's nerve damage that's messing with bladder control. So in those cases, the bladder might get all flaccid and it can't empty properly. That's uncomfortable, and it can even lead to complications. But bethanol can help get that tone and function back, which really improves the patient's quality of life.
Makes sense. Okay, let's switch gears completely. What about glaucoma? That eye condition where the pressure inside the eye goes up. If it's not treated, it can cause vision loss. And cholinergic agonists, they're super important in managing that, right? They work by changing the pupil size and how fluid drains from the eye.
Yeah, exactly. And one of those key points from the materials is how important meiosis is. That's the constriction of the pupil in treating glaucoma. So these cholinergic agonists, especially the ones that are given as eye drops, they can cause that meiosis and help get rid of that extra fluid in the eye, which lowers the pressure.
Right. And pilocarpine is one of those direct-acting muscarinic agonists we talked about earlier that's used for this. It comes in both eye drops and a gel, so it's pretty easy to use and effective at managing that intraocular pressure. The text also mentioned carbachol,
hmm
which is another direct-acting agonist that's sometimes used when pilocarpine alone isn't enough.
Yeah, carbachol is like stronger and lasts longer than pilocarpine, but it also can cause more side effects, so we have to be careful about who we give it to and really monitor them closely. We usually save it for those trickier cases where other treatments haven't worked so well.
I see. And then there's ecothiopate, that indirect-acting cholinergic agonist. The text mentioned that one too for glaucoma. So it's working by blocking that acetylcholinesterase. So the acetylcholine hangs around longer and keeps those muscles that constrict the pupil working.
Right. But ecothiophate's usually saved for when nothing else is working because it can cause more side effects since it lasts for such a long time. It's kind of like you start with the gentler options, and if those don't cut it, then you move on to the stronger stuff.
Okay, that makes sense. So now let's talk neurology. Alzheimer's disease, it's a really tough condition, and cholinergic agonists have become pretty important for managing the symptoms.
Yeah, absolutely. The objectives really highlighted how important acetylcholine is for how our brains work, for our cognitive function. And in Alzheimer's, those acetylcholine levels drop, which contributes to the memory loss and all the cognitive problems. So these cholinergic agonists, especially the indirect acting ones, they can bump up those levels and potentially help slow down that decline.
And the text talked about three main indirect-acting cholinergic agonists that are used for this: donepezil, galantamine, and rivastigmine. They all work by blocking that acetylcholinesterase, so there's more acetylcholine available in the brain. They're usually taken once a day, and they have been shown to improve cognitive function and slow down those symptoms for some people.
But we have to remember, they don't cure Alzheimer's.
Yeah,
They
sure.
just manage the symptoms and maybe slow it down a little, but they don't fix the actual problem in the brain. It's really important to be upfront with patients and their families about that.
Definitely. Okay, so then there's myasthenia gravis, another neurological condition where cholinergic agonists are really helpful. It's that autoimmune disorder that messes with the communication between the nerves and muscles, leading to muscle weakness and fatigue. And the name itself, myasthenia gravis, literally means grave muscle weakness.
Yeah, it's a pretty serious condition. And basically what happens is the body's own immune system attacks those receptors for acetylcholine at the neuromuscular junction. That's where the nerves and muscles connect. And this screws up the signals between them, which causes the weakness. So cholinergic agonists, specifically cholinesterase inhibitors, they help to improve that communication by boosting those acetylcholine levels at the neuromuscular junction.
And the text mentioned pyridostigmine as a common cholinesterase inhibitor for myasthenia gravis. People usually take it several times a day, and it helps to increase the acetylcholine at that junction, which leads to better muscle strength and less fatigue.
Right.
So they can actually do more and get around better.
Exactly. Now, let's jump back to those review questions. The third one asks, which assessment is most important for the nurse to perform before giving bethanechol? This is all about, what does the nurse need to do to make sure the patient is safe and the medication is given the right way? And it gives us a few options: checking bowel sounds, monitoring intake and output, checking blood pressure, and seeing if their belly is distended.
Right, and the answer key says the most important assessment is evaluate for the presence of abdominal distension.
Exactly.
Because Bethanethol, remember, it stimulates those GI muscles. So if someone has a bowel obstruction or their belly is really distended, giving them Bethanethol could make things worse and cause problems.
It's really all about making sure we're giving the medication safely and appropriately for each patient.
Right,
Yeah.
absolutely. Okay, next question. The nurse is caring for a patient receiving an indirect acting cholinergic agonist for Alzheimer's disease. What is the nurse's priority assessment? So, back to Alzheimer's and those indirect acting agonists. And they give us a few options here: monitoring for signs of cholinergic crisis, assessing for changes in cognitive function, checking for swelling in the legs and feet, and monitoring their intake and output. Which one's the most important?
So the answer key tells us the priority is to monitor for signs of cholinergic crisis.
Right, because these medications can increase those acetylcholine levels too much, and that could trigger a cholinergic crisis.
Exactly. And while all of those other assessments are important too, watching out for cholinergic crisis has to come first.
So we really need to be able to spot those early signs, like severe abdominal cramping, tons of saliva, muscle weakness, and trouble breathing.
Absolutely, yeah.
Being able to act quickly can make a huge difference. It's all about keeping our patients safe, especially with these medications that could potentially cause such a serious reaction. Okay, the fifth question is, the nurse is teaching a patient with myasthenia gravis about pyridostigmine. Which statement by the patient shows they need more teaching?
Okay, so this is all about patient education. We need to make sure our patients understand their meds, right?
Definitely.
Yeah.
And the options focus on how to take the medication, potential side effects, and what to watch out for. And the answer key says the statement that needs more teaching is, I should expect to gain some weight while taking this medication.
Yeah, because that's not actually true about pyridostigmine.
Right, it helps with muscle strength and function, but it doesn't cause weight gain.
This just shows how important it is to clear up any misunderstandings about these medications. Patients need to know what to expect, both good and bad, so they can be active in their care and know if something's not right.
Okay, last review question from this set. The healthcare provider is getting ready to give edrophonium to a patient with suspected myasthenia gravis. What's the nurse's most important action?
So edrophonium is a short-acting cholinesterase inhibitor, and it's used to diagnose myasthenia gravis. And they give us a few options here: checking the patient's ID, getting baseline vitals, getting the medication ready for IV administration, and making sure there's atropine available. What's the priority?
Okay, so the answer key says the most important thing is to ensure that atropine is readily available. Right, because edrophonium can also cause too much acetylcholine, which could lead to that cholinergic crisis.
Exactly. So having atropine on hand, that's the antidote for a cholinergic overdose, is super important just in case something happens.
It's all about being prepared.
Right.
Especially when we're giving meds that could cause a serious reaction. So now that we've gone through all that, I think it's important to remember that nursing care is about more than just giving medications. It's about looking at the whole patient.
Yeah, for sure.
And that's even more important when we're dealing with medications like these that can have such a big impact on so many different systems in the body.
So as we wrap up this deep dive into cholinergic agonists, let's talk about some of the key things nurses should keep in mind. We've talked about how these drugs are used for a lot of different things, and they can have both good and bad effects. So nurses really need to be on top of things to make sure patients are safe and getting the best possible outcomes. Exactly. As nurses, we're the ones who are actually putting this knowledge into practice. It's up to us to understand the ins and outs of these meds and use our critical thinking skills to provide the best care possible.
Okay, so let's break it down. What are some of the most important things nurses should think about when taking care of patients on cholinergic agonists?
Well, first things first, we need a really good patient assessment. That means getting a thorough medical history, finding out everything they're taking, even over-the-counter stuff and herbal supplements, and getting those baseline vitals.
Right. That helps us see if there are any red flags, like if someone has a heart condition, breathing problems, or GI issues, because those could get worse with these meds.
Exactly. We have to look at each patient as an individual and adjust our care based on their specific needs. And once we start the medication, we have to keep a close eye on them, especially their heart rate and blood pressure, since these drugs can affect the cardiovascular system.
Yeah, we want to watch out for things like bradycardia, low blood pressure, fainting, or dizziness. Those could be signs that the medication is having too much of an effect on the parasympathetic nervous system.
And it's not just about vital signs. We also have to pay attention to symptoms related to why they're taking the drug in the first place. Like, if someone's getting bethanical for urinary retention after surgery, we'd be checking their urine output to see if it's working.
Makes sense. So besides monitoring, are there any specific things nurses can do to help these medications work better?
Oh, yeah, for sure. For someone on methanical, encouraging them to get up and move around and make sure they're drinking enough fluids and getting fiber can help with both bladder emptying and bowel function. Unless there's a reason they can't do those things, of course.
Right. And what about Dunpizzle for Alzheimer's? What kind of things should we be doing for those patients?
Patient education is huge. We need to really explain what the medication does, what they might expect, and what side effects to watch out for. It's really important to manage expectations. Let them know that Dunpizzle isn't a cure for Alzheimer's. It might slow down the cognitive decline, but it's not going to reverse the disease.
And we should make sure they understand that they need to take it consistently, even if they don't see results right away.
Mm-hmm.
And talk about any possible drug interactions.
Yeah.
And make sure they know to report any weird symptoms or side effects to their doctor right away.
Absolutely. Now, let's talk about something really important, especially when we're giving these drugs intravenously.
Mm-hmm.
Cholinergic crisis. That's when someone gets way too much of a cholinergic drug, and it can be really serious. We have to be ready to act fast.
So we need to know those early signs, like I mentioned before, bad abdominal cramps, a ton of saliva, muscle weakness, and trouble breathing.
Exactly.
And we have to have atropine ready to go. That's the antidote for a cholinergic overdose.
It's all about being prepared and knowing what to do if something goes wrong. It's a big part of keeping our patients safe.
I think this deep dive has been super helpful. We've covered a lot of ground, from how these medications work to how they're used in different situations, what side effects to watch for, and what nurses need to do to make sure everything goes smoothly.
Yeah, I agree.
And as you continue learning and growing as a nurse, remember that things are always changing in healthcare.
Always, always.
So stay curious, keep learning, and be the best advocate you can be for your patients. Never stop learning.
Absolutely.
Well, thanks for joining us for this deep dive into cholinergic agonists. We hope you found it informative and helpful for your nursing practice. Remember, knowledge is power, and by understanding the science behind these medications and using your critical thinking skills, you can really make a difference. Until next time, keep learning and exploring this amazing world of medicine.